Okay, continuing on with reproductive abnormalities, but we're actually going to talk about something that can happen in both male and female-bodied people because everybody has an anus. So we're going to talk about anal problems in 6C. We just have room for it in this lecture, but of course it's not unique to males. These problems happen in female-bodied people too. So just a reminder of the anal anatomy. So remember that outer anal canal has that stratified squamous epithelium, but the inner part has that simple columnar, which is very delicate. So you'll recall that inside things are a little bit more delicate than on the outside. Also remember that the anus doesn't have any natural lubrication of its own. So anytime you're doing any type of anal sexual activity with penetration, you want to make sure to use some type of lubricant. Also, we talked about how the rectum can do reverse peristalsis, where it can not only push things out, but it can also push things back up. So if you're using any toys for anal sex play, you need to be really careful. Make sure they have a flared base so they can't get pulled up into the body and lost, and then you have to go get them removed by a physician. And then a couple of other things that I'm going to highlight here. So you see the blue and it says internal hemorrhoidal plexus. So plexus, we've seen that word before for the pampiniform plexus, right? So this is a grouping of veins. So we tend to have a lot of veins there present in the anus, and that's going to be pretty relevant to our discussion today. So just a couple things, let's go through them. The first one would be hemorrhoids. So what this is basically varicose veins, dilated enlarged veins of those veins in the hemorrhoidal plexus. So they've kind of shown you them here in this diagram in kind of pink and in purple, and they could be coming from the veins higher up or veins lower down in the anus. So things that increase your risk of getting hemorrhoids are anything that cause trauma, kind of mechanical trauma, physical wear and tear on that area of the anus. So for most people, these are caused by constipation, right? So having large, hard, or difficult to pass bowel movements and having to strain a lot. So anytime you have to bear down a lot, that can cause these veins to dilate and enlarge as well. So trauma and bearing down. Women who are female-bodied people who are pregnant, often just because of the weight of the pregnant uterus, sometimes can cause some kind of dilation of those veins. So hemorrhoids are very common in pregnancy. And of course, you can increase your risk for hemorrhoids if you're engaging in anal sex play without lube, because that's just traumatic to these veins which are present there, and they can get kind of irritated and swollen. So let's look at a picture of a hemorrhoid in real life. So we're looking at an anus here, and I will outline. All right, I had a technical problem with that last slide. So let's try again looking at the photo of the hemorrhoid, and here it comes. All right, and so if we look at this image, I'm going to circle the hemorrhoid in green. I don't know if you can see it. So it's that little pooching out, right? So somebody might feel it as a bump. It's usually soft. And usually it doesn't cause any bothersome symptoms. There might be some mild pain or aching sensation with it, especially if it's really inflamed or bothersome. But it's also, it's a pretty delicate skin over top of it, and so these hemorrhoids can bleed fairly easily. So usually the most common symptom is some bright red blood on the toilet paper with wiping after a bowel movement. They're harmless. Hemorrhoids are harmless. They just might be annoying. So if you develop hemorrhoids, the best thing to do is just to avoid any activities that would make them worse or irritate them. So abstaining from anal sex play for a while, making sure that you're not constipated, so taking some stool softeners or things to make going to the bathroom easy, being gentle when you wipe after going to the bathroom. Those types of things are usually sufficient, and they don't necessarily always go away, kind of like varicose veins in other places, but they can become less prominent and less bothersome. If they're really severe or really bothersome, then of course you can have surgery on them. Sometimes also you can get a blood clot in one, and they will also become quite painful. If that happens, just come to the clinic. We can kind of cut it out for you and help with that. That's not common, but it can happen. All right, so the next thing I want to talk about is an anal fissure. So an anal fissure is kind of like a paper cut in the anus. So again, the same types of things that might cause hemorrhoid can cause an anal fissure. So really large, hard, or difficult to pass stools, right? So the skin actually tears as you're pooping, or anal sex without lubricant or without sufficient lubricant, or anal sex without giving the body sufficient time to relax. Remember, we have those sphincter muscles there. Anal sex is not for the beginner. It requires a lot of kind of control of your body. So you can get a tear in the anal skin, and obviously that's going to hurt just like a cut anywhere else. And it would hurt when you go to the bathroom, when you have a bowel movement. And this also can cause some bright red blood on the toilet paper, like a hemorrhoid. But the difference between a hemorrhoid and an anal fissure is hemorrhoids usually don't hurt, and you can usually feel a little bump there. But anal fissures usually hurt, they're pretty sore. So again, we just want to support the tissue while it heals. So we just don't want to irritate it. So you want to take stool softeners, avoid any anal sex until that skin heals up again. So we'll take a look at a picture of one. This is an infant who got it because they were really constipated. And so you can see that arrow there that says anal fissure, that's that little cut in the anal skin. So as you can imagine, it's a sharp pain, right? You have a cut there. All right, this is a short one. So we just talked about hemorrhoids, which are usually painless and can cause some bright red blood on the toilet paper, and anal fissures, which are a small cut in the anus, and they usually are painful and can cause a little bit of blood on the toilet paper as well. They both can be uncomfortable, but neither one is dangerous, and the treatments would be the same.